All right, we continue our talk about the back to school questions that you might have, and one of them was, what about busing? Because I know from reporting in the news, social distancing and mask wearing and all of that comes into busing and keeping families together. Talk about that.
Busing is more complicated. We can't grow the size of our buses, just like we can't grow the size of our classrooms. We also have to live within the budgets and the resources that we have. And we also have to be able to be realistic on how many employees. I mean, we've had bus driver shortages for several years. That's not a new phenomenon. That goes back several years. So we're limited on the number of buses, we're limited on the number of drivers and routes, and we're limited by the size of those buses. So we're not going to be able to maintain as much physical distance as we would like, but we will maximize it as much as we can. We will do some things such as sit the older elementary schools in the back of the bus that are a little bit more independent and have more experience of knowing how to escape the back of the bus in case an emergency happens, and set the younger students up closer to the bus driver so that if we do happen to have one of those rare emergencies, the bus driver can help those younger kids. We will, whenever it's practical, try to sit family members together since they're already going home together. We will have assigned seating. Unfortunately, one of the changes that really affects the elementary school probably more than the other levels is we may not be able to make a change in the middle of the day to go home with a friend. And we're going to have to stick with our normal routine bus assignments. Because if we do have a person have COVID and have a case, we will need to report to the Allen County Department of Health who is sitting near that person. And so by having seating charts, by keeping seating the same on most days, we reduce how many kids have to be quarantined or number of families that might be affected by a case. And that's what's important to understand is every piece of our reopening plans are designed to accomplish two things. One is to reduce the number of cases so that our families don't have to interact with it, hopefully. And the second one is when there is a case, we reduce how many kids have to be quarantined or the number of families affected by it by reducing how many kids are near the person with the case. If we did not implement these things, it would increase the chances that we would have to quarantine an entire class or an entire grade level or an entire school. And we don't want those interruptions. The easy part is opening. The hard part is avoiding the interruptions that might come up. As the doctors have informed us, we're going to probably have cases. And it may or may not be because of the school. It could be because of religious services or family gatherings, going to a restaurant, going to a store, other activities that take place outside of school, youth sports, travel teams. It may or may not have anything to do with the school, but because it's everywhere in our community. But wherever it is that it happens, we have to deal with the ramifications and keep people safe, and that's what we're going to do. And we're partners with the Allen County Department of Health. We will follow their directives as they have to follow the directives that they get from the Indiana State Department of Health.